Dr. LaChapelle, Diane, was the chair of our provincial board here in New Brunswick for several years and made a really strong contribution to what we do here in the province. So that's a really special connection we have. In terms of her training, Dr. LaChapelle did a PhD in clinical psychology out of the University of Regina, and then came to UNB Fredericton, and has been doing clinical work in Fredericton and research work as well, and teaching, mostly relating to chronic pain and disability. She's been funded by some very prestigious funding agencies in Canada, and she's worked together with groups like us and the Stan Cassidy Centre in Fredericton to do some of the research and to make sure that some of the research findings actually make care better for people with arthritis and other kinds of pain. She's done an awful lot of work in acceptance, which is why we're here tonight, and that critical piece is so important in managing any kind of persistent kind of health condition. So we're really, really, really fortunate to have you here tonight. And just please join me in welcoming Dr. LaChapelle to the stage. Thanks.
Thank you for having me. I'm a bit of a walker when I talk, so I prefer not to use the microphone, but I'm not sure if you can hear me in the back. Is it good? Okay, if I start to fade too much, just put your hand up, and I'll know that that means I need to talk more loudly or use the mic. So as Krista said, I'm here to talk about the process of acceptance. And one of the reasons I focus on acceptance is because I believe it's the fundamental component that determines our emotional response to illness. And really, it has the biggest influence on the long-term outcome in terms of our emotional responses and how we adjust to living with a chronic illness. So I'm going to talk about several things tonight. First thing I'm going to do is talk about why a psychologist is involved in chronic illness in terms of caring for people who have chronic illness. I'll move on to talk about the process of acceptance, and I'm going to look at it from two angles. One is what the scientists and the researchers, people like me, say, and the other angle is what people with chronic illness actually say about the process of acceptance. And we come at it from two different angles, so I think it's important that we understand each other in terms of those perspectives. From there, I'll talk about how acceptance relates to the emotional response to your chronic illness, and talk about some ways to facilitate the process or speed up the process of acceptance so that the emotional response can become more adaptive more quickly. So first of all, why psychology? One thing I know when people get referred to my clinical practice is if your doctor tells you you need to see a psychologist, people sometimes say, why do I need a psychologist? My pain is real, it's physical, it's in my body, it's not in my head, I'm not making it up, I'm not lying, I'm not crazy. So I want to reassure you 100% that is absolutely true. I don't see crazy people in my practice. I see normal, everyday, regular people going through very extraordinary circumstances, adjusting to living with a chronic illness, living with chronic pain that affects you 24 hours a day, 7 days a week, is a tremendous stressor in your life. And dealing with that is very difficult. That is why you're being referred to a psychologist. Not because the doctor doesn't believe that your pain is real, but because we know how much of an emotional toll it can take on a person's life. We know that pain can make you feel frustrated, angry, depressed, anxious, irritable, and the list can go on and on and on. So again, that is why a psychologist can play an important role in caring for people who have chronic illness. Now, 80% of doctor visits stem from a complaint of pain. So 80% of the time when doctors are seeing a patient, the patient has come in because they have a pain complaint. That's a very high percentage of their patients. The vast majority of times, the doctor can give you something very easily. It can treat the pain. It goes away. It gets better. The doctor doesn't see you again. 40% of people, however, in Canada, between 30 and 40, depending on the study, have chronic pain. So they go to the doctor attempts the traditional treatments that they usually give people, and they find out that it's chronic, it's not going away, it doesn't seem to be easily resolved. So what happens is your doctor is used to fixing the problem. Your doctor is used to having people come in, I give you a prescription or I recommend a treatment, you go do that and you get better. The healthcare system in Canada and really in North America is not designed for chronic conditions. So when you're coming back to your physician and saying, that didn't work, and he says, try this, and you come back and say, that didn't work, and she says, try this, and you come back and say, that didn't work, the fact is, your doctor, your healthcare professional, your physiotherapist, whoever you're seeing, they can become equally frustrated, irritable, defeated, feeling like they're not able to help you. So they often feel a lot of the same emotions that you are feeling. It's really at that point where they've tried everything they can throw at you, they've used all of their knowledge to help you, when they will say those words that patients absolutely hate to hear, which is, there's nothing more I can do, I've tried everything I know, you're still not improved. So at this point, the best advice I can give you is you're going to have to go and figure out how to live with this. This is now a chronic problem. It's not going away. You're going to have to figure out how to live with it. You've probably all heard some message similar to that, and you probably didn't like it very much. People really don't like to be given that message from their healthcare professional. The reality of our medical sciences, however, is that we do not have the knowledge or the technology to figure out every source of pain. Our medical sciences are not very good at it yet. We often can't identify why a person is suffering. Even when we can identify the reason, so even if we can point to it and say this is fibromyalgia or this is rheumatoid arthritis, it doesn't always mean that the treatment is going to be effective. People respond differently. So the sad news from an illness point of view or a chronic illness point of view is that technology isn't perfect yet. We don't have the magic bullet yet for every person's chronic condition. So once you get this message, it can be quite discouraging. The interesting thing, though, is that this is actually a really good message to give you. This is exactly what we need people to do. We need people to start to learn to live with their condition and adjust to it and make the adaptations that they need to live fulfilling lives, despite the fact that they're left with the chronic condition. That is, in a nutshell, the process of acceptance. The process of acceptance is essentially learning to live with your chronic condition. If we look at what the researcher tells us, most of the work, early work in acceptance was done by a group of researchers in the UK, led by Lance McCracken. And he has basically come to define acceptance as involving two key ingredients. The first ingredient is what he calls pain willingness, which means recognizing the pain is not going to go away, recognizing it's not going to change dramatically, that your efforts to control or avoid pain at all costs is not going to be an effective strategy. It's not going to work very well. The second component of acceptance is what McCracken calls activity engagement. And this essentially means living your life, doing the things you want to do, even though you still have the chronic pain or the chronic fatigue or the chronic illness aspects that are particularly troublesome to you. So two components. You have to acknowledge it's chronic. You have to make peace with the fact that it's chronic and that it's not going to go away. That means you have to give up a search for the magic pill or the magic surgery or the magic cure. And then you have to live life. You have to engage in the activities that are important to you. So this is what the research tells us. The research has shown over and over and over again that acceptance, people who are able to do those two things, do much, much better in terms of living with their chronic illness. There are tremendous benefits to acceptance. There's better psychological functioning, better social functioning, better work-related functioning, better physical functioning. People improve at work. They're able to work more fully. And we actually see people who are able to accept reduce their pain medications and reduce their reliance on the healthcare system. So we know from the research, and from a lot of years of research, that acceptance is a good thing. Learning to live with your illness is a very good thing. So basically what that means is if, as a health professional, we can find a way to facilitate that or to get you through the process more quickly, then you're going to do much better, we're going to do much better, the system is going to function much better. That's what the research tells us. That's great. What the patients tell me when they come to see me is not very nice sometimes, because they don't like the message that you need to learn to accept. So I was very curious, knowing what I know from research and trying to apply it to patients, why do they react so negatively to that message? Why is it such a hard thing for them to hear? So wanting to find that out, I'm a researcher, I did a research study. And it's a research study I did here in New Brunswick, facilitated by the Arthritis Society. They helped me find people to participate. And we did focus groups, 11 focus groups across Fredericton and here in Moncton. And we basically had groups of women come in and sit down and talk to us about acceptance and what it meant to them. What I did essentially was give the women who are sitting in the room with me, I gave them the definition I just gave you. I gave them what the researchers say. And then I said, but what I'm really interested in is when I say to you, you need to learn to accept, what are you hearing? What's the message that you're receiving from me? So this is what the patients told me. If you tell me to accept, you are telling me to give up. I am going to feel defeated. I'm going to feel like I am giving up all hope of life ever getting better. So that's a pretty different message than the message I'm actually intending to give. So it's important for us to understand what patients hear when we give them instructions. If we look at those two components that McCracken defined as pain acceptance, it was this idea of pain willingness that the women in the groups really rejected the most strongly. They did not like the idea that they were supposed to willingly accept that pain was here to stay and that it was chronic and it wasn't going to go away. The activity engagement piece, they could buy into that, but this pain willingness piece, they did not like at all. For them, it really meant that they were giving up all hope. And if you ask me to give up hope, you're basically asking me to become more anxious, more depressed, more discouraged. So how is that supposed to help me? They much preferred to use terms like coping with. I need to learn to cope with my illness. I need to learn to deal with my illness. I need to come to terms with my illness. Those words they could use and they could understand. And they really defined those words in relation to that activity engagement aspect of pain acceptance. So coping with an illness, dealing with the illness for those women in those groups meant that they needed to carry on with their activities, engage in their activities, live their life even though they have pain, but don't ask me to give up hope that the pain could actually also get better. That was the message that we heard loud and clear from the women. Now you can argue, is it just you're just playing with words. Acceptance, coping, acceptance, dealing with. In a way, you are just playing with words because in essence, they mean very close to the same thing. But what we know from, or what at least I know very clearly from working with patients, is I need to use the language that you're going to respond to. So rather than saying you need to accept your illness, maybe I need to say you need to learn to cope with it, because you're going to respond more positively to that. So if we look at what acceptance is, or what coping is, whichever word you want to use, I'm going to stick to acceptance because it's the research term, and it's the term we use in the literature. If we ask you, the women in the groups, what it is or what it isn't, this is what they told us. Acceptance is not a decision or a belief. You don't just wake up one day and decide, today's the day I accept that I have a chronic illness. Today's the day I come to terms with it. That doesn't work. It might work for the 10 minutes after you make the decision, but then something's going to happen that's going to have you flip-flop the other way. It's definitely not an all or nothing thing. Again, it's not like one day you've accepted, whereas yesterday you hadn't accepted yet. It's a very long, complicated process. It's a process that ebbs and flows. Some days you're going to be very accepting. But you might have a pain flare-up or a bad day, and you're going to be less accepting. So it's going to fluctuate over time. What we do know is that the fluctuation over time generally gets higher. So you become more and more accepting over time, even though you're going to have this ebb and flow. What acceptance is basically a series of realizations, a series of lifestyle choices that you will make over time. So you will make decisions about your activities, about things you want to do that will lead you towards acceptance. And the more decisions you make in that direction, the more accepting you become. So one of the things I was most interested in when I did this research was, how do we get people there faster? We know acceptance is good. That's where we want people to end up. But how do I get them there faster? It's my job to get them there. So that's what I asked the women. And these were women who had had arthritis for all various numbers of years, some very newly diagnosed, some who had had it for a lot of years. So I could get a very wide perspective. The very first thing they told us was, you cannot possibly accept if you don't know what you're dealing with. So number one thing those women said was required was a diagnosis. Sometimes that's easy to come by. Sometimes that's really hard to come by. There were women in our group who had fibromyalgia for 10, 15, 20 years before they got a diagnosis, which meant they didn't know what they were supposed to cope with. They didn't know what they were dealing with. So there are a lot of rare conditions that sometimes can take a long time to get the diagnosis. And until you have that, until you know what you're supposed to deal with, how do you go about doing that? It's very challenging. So it's in that uncertainty stage where you don't have the diagnosis that is the most difficult. So you need to acknowledge the problem exists. You need to sort of realize that this is not normal, this pain that I'm experiencing, or this fatigue that I have. It's not going away. You need to seek out help and ultimately get that diagnosis. Once you have the diagnosis, it is perfectly normal and expected that you are going to try to find out how to fix the problem. You will go through a phase of searching out some sort of cure. And that is completely expected. Why should you have to accept something before you really are sure that it's a chronic condition and that it can't be improved dramatically? So there's going to be a period of time where people search for this cure. The problem is, where the problem comes in is that people get stuck in that stage. They get stuck in that search for a lot of years potentially. And it's when you're in that searching stage that a lot of harm can be done, and you can really be taken advantage of. There's a lot of people out there who would like to make a lot of money off of you. You're suffering, you want to feel better, people will take advantage of that and sell you all sorts of things. And I've heard a wonderful amount of different stories, including, you must soak 40 bulbs of garlic in a 40 ouncer of vodka, and then if you drink that, your fibromyalgia will go away. It doesn't work. I can tell you it does not work. But people want to make money. They'll have you coming for, various alternative treatments for years if you'll keep paying. So it's a very risky stage in terms of people's mental health, because it's hard when you're looking for that cure. But essentially what's going to happen is you'll try a bunch of things, and at some point you'll realize that you've sort of run out of options, and it is time now to accept, or time to learn to start to manage the condition instead of looking to get rid of it altogether. So what is acceptance? We've talked about the activity engagement and the pain willingness components, but what acceptance actually is, what it looks like in real life, is a redefinition of what you consider to be normal for you. What is your normal day look like, your normal week? In order to redefine normal, you have to be able to accept that because of this chronic illness, you now have limitations that are placed on you. You can't do everything you once did. So there are some things you're going to have to give up. And when you give those things up, you become a different person, and that becomes a new normal, the new you. And that, in essence, is really the process of acceptance. When you start to give up things, obviously you start to experience losses. And it's the losses that ultimately lead to this emotional turmoil that people go through when they have chronic illness. It's much the same as mourning the loss of someone who has died, because you need to mourn the loss of pieces of yourself, pieces of your identity that you are giving up. So acceptance is really acknowledging the need to give up certain things, to make those adjustments, and to take on new roles. So you're going to start to live a new life in the context of a chronic illness. Now, probably the easiest way to make it most understandable, or make the picture as clear as possible, is to talk about a real person. So we're going to talk about Elaine. She is a 35-year-old woman with fibromyalgia, which is a type of arthritis, or at least comes under the arthritis umbrella. She works full-time as a teacher. She has 2 young teenage sons, and she has a husband who also works full-time. So Elaine, when she factors in her commute to get to and from work, factors in the time she has to spend grading papers. She's a primary school teacher. She's leaving the house around 7:30 in the morning. She's getting home around 5:30 at night. Pretty full day. She is doing marvelous at getting through her day. She gets up, she goes to work, she teaches all day, she comes home at 5:30, and what do you think she does? Crashes, absolutely. She's so exhausted by the end of that day that she basically has to go into her bedroom, lie down, rest, recover, recuperate, so she can do it all again tomorrow. The weekends, same thing. She's just using the weekends to recuperate. So think of everything in her life that she's probably given up. She's not spending much time at all with her husband. She's not spending much time at all engaged with her kids. She feels like an utter failure at home because her house is a mess and the kids are eating pizza and Kraft dinner for supper, and her husband's getting annoyed because she never has time for him. She doesn't even see friends. She can't remember the last time she went out of the house to do something fun. But she's working. That's all she has left. So you have Elaine, who used to live this very full life with all of these activities, and she's become a very narrow person. She's getting through the workday, but that's about all she can really manage. So if you look at her identity, she still is Elaine the teacher, but all of her other pieces of herself have gone by the wayside. So she's lost herself as a mother, as a wife, as a friend, as a gardener, as all of these other things that were once really important to her. She views herself as damaged goods because she can't do all of these things that she used to be able to do. Again, if you come back to that definition of acceptance, you look at activity engagement, it's extremely narrow. She's engaged in only one activity, and that is her job. She does it well, and she gets through the day, but that's all she's really able to manage. If we think about identity, the top of this pyramid, identity is essentially, if I said to you, tell me about yourself, you would be describing your identity to me. You would be saying things like, I'm a mom, or I'm a wife, or I'm a Catholic, or I'm a teacher, or I'm a gardener, whatever. All of those things, that is how you identify yourself. Our identities are made up of those different roles that we play. So wife, mother, teacher, those are all roles that we play. They make up our identity. Each of those roles is made up of activities. So being a wife, for example, or a spouse, if we want to make it gender neutral, being a spouse involves a lot of different activities. It involves everything from companionship to sexuality to sharing in household duties to doing leisure activities together, raising kids together. There's a lot of different activities that go into that individual role. What happens when you have a chronic illness and you're struggling to cope with that chronic illness? Most people, in an attempt to reduce their pain or their fatigue or to deal with the various aspects of their illness, they start to give up activities one by one. Well, if I don't do this, I'll feel better. If I don't do that, I'll feel better. Every time you give up an activity, you give up a piece of a role. The more activities you give up, the more you eliminate roles. The more roles you eliminate, the more you lose your sense of self. The more you lose your identity. The more narrow that definition becomes. So if I ask Elaine her identity, at this point, she's going to focus on being a teacher because that's all that's left to her. All those other pieces have gone by the wayside. So when people come in to see me in my psychology practice, and they tell me they're feeling distressed, depressed, sad, angry, I always ask them why. Why are you feeling that way? And they look at me like I'm crazy. Because it seems so very obvious to them. Well, I'm depressed or I'm angry because I have this horrible illness and I feel horrible all the time. I'm in pain all the time. And that is probably true to some extent, but that's not really the source of the anger and the depression and the anxiety. The source of all of those emotions is all of those losses, all of the things that you have given up in an attempt to deal with your illness. People are angry that they can't do all the things they used to do. People are depressed because they're not the friend and the wife and the mother that they used to be. They're anxious because they can't work like they used to, or they can't work at all and they're worried about financial issues. So yes, the illness contributes directly to depression and anxiety and all of those emotions, but it's really much more about the losses, the things you have given up that cause the emotional turmoil, much more than the illness itself. So if we look at the various emotions that people experience, they tend to change over the course of an illness. In the early stages of a chronic illness, you predominantly see disbelief and some anxiety. In the early stages, people often don't believe that they have the illness. They believe that they will be different, they will be able to get through it, they will be the one person for who the medication works perfectly. So there's a lot of disbelief that this is in fact chronic and that it's here to stay. When it stays and it sticks around, and you're sort of moving past that disbelief and you're getting to that realization that this is here to stay, this is when people start to go through that grieving process. They start to experience the losses and therefore start to feel some of that depression about those losses. Guilt is extremely common. People feel guilty about all the things they're not doing. I'm not keeping the house the way I used to. I'm not playing basketball with my sons in the driveway the way I used to. All of those things that you give up cause feelings of guilt. People feel bad that they can't do those things. They feel bad that they're not the spouse they once were. Anxiety, common in the early stages, but it can certainly be common throughout a chronic illness altogether. There's lots of worries about what the future holds. Is this illness going to get worse? Am I going to be able to do even less in the future? Is the pain going to always be this bad? Is it going to get worse? What's the future look like? Is my husband going to leave me because I can't take care of the house and cook dinner the way I used to? There are lots of things to worry about, so it's really not surprising that people feel all sorts of anxiety. Anger is huge. The issue with anger is, where do you direct that anger? Some people direct it internally. They get very angry at themselves. They feel like they should be able to conquer this, they should be able to do better. Some people get angry at the healthcare system, they should be able to fix this. Some people get angry at God or the world or the universe or just in general. One of the struggles with anger is that it needs to come out. You can rarely hold anger inside all the time. And the saddest part about anger is that the people who get the brunt of our anger are the people who are closest to us. We're not necessarily angry at our kids. We're not necessarily angry at our spouse or our friends, but they're the ones that are there to listen to us. So they often sort of receive that anger, or at least hear the anger, and that can cause problems in relationships. One of the things that goes along with chronic illness is irritability as well. And it's sort of a level lower than anger, but it's that sort of always being on edge where everything annoys you. And so, if you're suffering and if you're in pain 24 hours a day, you're sort of on edge all the time, which means little things that used to just not bother you at all, they will start to annoy you. So all those little things your kids do, like leave their socks and wet towels and whatever in the bathroom that you used to just roll your eyes at and pick up, when you have a chronic illness, all those little things start to just get on your nerves, and you see a lot of sort of outbursts, and that's tied into the anger. But it's really irritability and being on edge. Perhaps the emotion that comes to mind most frequently with chronic illness is depression. If you look at the research, depending on what study you read, anywhere from 70 to 100% of people with a chronic illness will go through a period of depression. So what that tells you is it is perfectly normal to go through a period of depression. And again, that depression is tied to those mounting losses. It's tied into the things that you have had to give up because of your illness. Okay, so let's talk about some practical strategies for sort of working your way through this emotional roller coaster. The first thing that needs to be done is you need to be able to identify what it is you have given up or what it is you have lost that is the most distressing. So what are the pieces of yourself that you have had to lose or that you have given up? Again, that's really what underlies our emotions. It's those things that we have lost. That is what makes us anxious and depressed and angry. So if we can identify what it is, we at least have a place to start in terms of managing all of the emotions that go with it. One thing about identifying losses is you need to face the facts, but you need to also be realistic. So for example, if you have arthritis that makes your joints very stiff, you have a hard time getting going in the morning, it takes you extra time and you've been late for work the last few days. Being realistic means you don't jump from that to I can never work, or it's impossible for me to carry a job or hold down a job. Obviously, there's lots that goes between being late a couple days because of stiffness and being unable to work. There's all sorts of solutions you can come up with. Maybe you change your schedule so you work afternoons, or you work something out with your boss so that the schedule is shifted later, or you get up earlier, or whatever needs to be done. So you need to identify the losses, but be realistic about what they actually are. If we were to make a chart for Elaine in terms of what was lost, if we look at pre-arthritis or pre-fibromyalgia for her, what are all the different roles that she used to play? So she has a family, she was a worker, she was a volunteer, she had all sorts of hobbies that she did. She liked to hang out with her friends, and she also was taking care of the house for the most part in terms of keeping it clean and making sure the kids were well fed. So if you look at all those roles you play, what you need to look at is what priority do you place on them? How important are those various roles to you? So that's what the numbers mean. She was engaged in all of those activities, but before she had fibromyalgia, while she was fully healthy, if I had asked her, which of those roles is most important to you, she would have told me family. That is the most important thing. I want to be a really good mother. I want to raise my kids right. That's where I want to place my emphasis. She was very proud of being a teacher, so that was her second priority. And then you can see how the other things sort of rolled out. Yes, it was important to keep the house clean, but it's down at number 3. Volunteering she likes, but it's number 6. She wants to meet the needs of her family and her job well before she volunteers extra time. If you look at how she's functioning now, she's only got 3 roles left. She's got work, the house maintenance that she tries to keep up with, and her family. But look at how her priorities have shifted. She's putting all of her effort into surviving the workday, so that has become her priority. I just need to get through the workday. My family is still important, it's still at number 2, but it's certainly coming second at this point. The really interesting thing when you ask people to do this exercise is that their current priority list was never made consciously. They did not consciously sit down and say, yes, I've decided my family comes second now. People don't do that. They just naturally start to drop things that they feel like they can drop. but people rarely feel like they can drop the things where there are external requirements. So people rarely feel like they can drop job responsibilities because that's an external responsibility. So they start to give up things that are important to themselves without really ever thinking through whether that's the best thing for them or the best idea. So once you identify the losses, you need to actually work through the emotional pain. Trying to avoid your emotions, I guarantee you, will not work. You need to feel them, you need to experience them in order to come out the other side of them. Again, first step in working through them is to actually know what they are. You need to know if you're angry or depressed or anxious. So you need to identify those feelings. You need to express the emotion. And by expressing it, you can express emotion in a lot of different ways. You can talk to other people. You can write in a journal. You can talk out loud to yourself. You can talk to a psychologist or a physician. You can go to a support group and talk. But you need to be talking about the emotions. If you're not a talker, become a writer. Write in a journal. It's tremendously therapeutic to get those emotions out. An interesting thing is that people often tell me, if I start letting those emotions out, it's going to like explode out of me. If I let that anger out, it's going to be uncontrollable. Or if I start to cry, I will never stop crying. I guarantee you 100% you will stop crying. There's only so many tears in your body. You are going to feel exhausted after you've had a good cry, after you've had a good talk about those emotions. You will absolutely feel exhausted, but you're also going to feel a renewed sense of determination to start to deal with the things that led to those emotions. The longer you keep them blocked up, the longer you're not dealing with them, the longer you're not going to come up with any strategies for coping with them. They have to come out. They absolutely have to come out. So share those experiences with other people if you can. Support groups are great. Family needs to understand what you're going through. The only way they understand what you're going through is if you actually talk to them and share with them what you're feeling. You need to go through a mourning process. You have to mourn and grieve the losses that you have experienced, just like you would grieve the death of a loved one. It's a very similar process. And that the time it takes to mourn those losses is different for everyone. There's no one who can say, look, you've got 3 weeks to mourn your losses and then you should be over it. It doesn't work that way. Maybe it's going to take you 6 months, maybe it's going to take you a year, maybe you'll be faster, I don't know. But it is a process. You need to work towards acceptance, sort of coming right back to where we started in terms of acceptance being one of the most crucial pieces of successfully coping with your chronic illness. So in order to work on acceptance, you need to be able to identify your priorities. So when Elaine started investing all of her limited energy just in work, she never consciously thought about her priorities. She didn't sit down and think about, okay, if I only have this much energy, where should I put it? What would I want to do with that limited amount of energy? That is what you're going to need to do in order to start moving towards greater acceptance. You need to identify your priorities. What is most important to you? What are your core values? It's interesting that very few people can identify what a core value is to them or what's important to them. And the reason most people can't do that is because we simply don't think about our lives in that way. We sort of always just unconsciously or automatically made decisions about how to spend our energy. We've never really thought about, well, if I had limited energy, what would I do with it? So actually identifying priorities and core values takes a while. It takes some work. It takes some discussion to figure out what they are for you. Once you have identified priorities, you need to take responsibility for making changes in your life. Again, if you've only got so much energy in a day because your chronic illness is sucking up all the other energy, where are you going to spend it? What's important to you? How are you going to invest it? You need to reinvest that limited time and energy into those things that are important. If you invest your time and energy in important, valuable things to you, I guarantee you, your mood will improve. You will start to feel better because you will be doing things that are important to you. You will be doing things that are enjoyable to you. Keep in mind that change is an ongoing process. Okay, so again, it's not all or nothing. You don't write down your list of priorities and the next day everything changes. It's a process where you start to reinvest, taking time and energy away from activities you don't prioritize and putting it into activities you do prioritize. The other thing that's really important to remember is that change is not permanent. Maybe at this point in time, in an early stage of your illness or in a flare-up stage of your illness, you've got even less energy, even less resources, and so you have to be even more narrow in what you choose to invest in. But that doesn't mean that's always going to be that way. Maybe if you instead prioritize your health and prioritize things that are important to you, you're going to actually start to feel better. You're going to be able to manage your condition better. You're going to be able to have more positive emotions. And as you start to feel better, you're going to have more energy, which means, oh, I can add something to my list. I can have another role come back in. So change is always fluctuating. So again, if we put Elaine's chart back up and we ask her to actually think about her priorities, if we look at what she decides is going to be her new normal, it comes back to family again. That was her priority before she was ill. It's still her priority. She just didn't realize that she wasn't focusing on it. So now family becomes her priority again. In order to invest her energy in family, she needs to make some substantial changes. She realizes that I can't be working full time if I want to use my energy for what is actually important to me. So she decides to job share. She works half-time only, shares with another teacher who only wants to work half-time, meaning she can now use that energy for her family as she wishes. Not only that, she can start to reintroduce some of the other things that she has given up in order to survive her work life. Now, for Elaine, she could do that. Financially, her husband worked full-time. She didn't financially necessarily need the money of a full-time salary, so she had that benefit. That comes into prioritizing, right? If her family depended on her salary, she would have to prioritize work more highly. So she would have to continue to invest her energy in that. But again, it's about making those conscious decisions and not just letting things happen. You have to make the decision, is this good for me and should I do it? One thing that you need to do in order to manage the emotional distress is you need to focus on today. You need to focus on the now. So what that means is at the end of the day, when you're sort of evaluating your day, was it a good day or was it a bad day? You need to not evaluate yourself and your accomplishments in comparison to your accomplishments before you were ill, because that's a really unfair comparison. You need to be evaluating yourself in the context of the here and now. Given I have this illness, given that today my pain was a 6 out of 10, how do I feel about what I accomplished today? How do I feel about how things went? You want to focus on the here and now, not on the past, not on comparisons to the way things were. You also don't want to project yourself into the future because you don't know what the future is. So you can only ever live in the current moment. So again, invest your energy in what you can do now, not on what you've lost, or not on what you're not able to currently do. Learn and practice mindfulness. Mindfulness is essentially, it comes from Buddhism. It's a Buddhist philosophy of living in the now. It's about not worrying about the future and not focusing on stuff from the past. So it's very in keeping with the process of acceptance and helping you with that process. I'm going to put up a list of resources at the end, a couple books to recommend to help you learn mindfulness. It's actually, if you just did a search on the internet on mindfulness, you will find tons of information on it because it's a very strong movement in the healthcare system right now to teach people mindfulness because we know it helps improve chronic illness. Consider keeping a gratitude journal. I'm coming back to this whole idea of journaling and writing because it is tremendously therapeutic. If you end every day writing down 3 or 4 things that you are thankful for, you end your day feeling good. And there's always something you can find in your day to be thankful for. Even if it's just to be thankful that your pain was a 6 today and not an 8 like it was yesterday. There's always something to be thankful for. Again, evaluate your success, your accomplishments based on your current context, your current circumstances. Do what you can to involve your family. Family often feel very separated from the person who has an illness. A person with an illness often sort of becomes an island unto themselves. They don't want to burden other people, so they don't want to talk about things. They don't want to make other people feel sad or bad or anything, so they try not to share their pain. But if your family does not know what you're going through, all they feel is, you've cut me out, and I don't know why you've cut me out. Have I done something wrong? Do you not love me anymore? What's going on? So talking and engaging family is really important. The other thing I want you to keep in mind about family is that just like you are going through a process of accepting, everyone in your family has to go through the same process. They're not going to go through the process the same way you do, because everybody goes through it in their own way, but they have to go through their own process of acceptance. So if I'm a spouse and my husband has a chronic illness, I have to accept that maybe we can't do all the things we once planned. I have to accept that the nature of our relationship has to change a bit, or our activities have to change. So they are also working through an acceptance process, which again is why the communication process is so very important. So you can both talk about what it's like going through that process. Family roles have to be redefined. So maybe you used to be Superwoman who worked and cleaned and cooked and took the kids to all their activities and did all of that. Or maybe you were Superman who worked and mowed the lawn and shoveled and took the kids to all their activities and cooked and whatever. When you have a chronic illness, you can't be super anything anymore. You can't do everything, which means those things you used to do in the family, somebody else has to pick up those activities. So everybody's renegotiating. Everybody's figuring out, okay, so if you're not going to cook anymore, I'm going to cook, or if you're still going to cook, I'm going to do the groceries and have everything ready for you, or whatever. But you can't negotiate those roles if you don't talk about them. Education for families is really important. They need to know what the illness is. They need to know what can be expected from the illness. but they also need to be educated about the emotional experiences of the illness. They need to understand why you're so irritable or why you need to make certain changes. The more they know, the more supportive they can be. So I always extend an offer to all of my patients for them to bring in their family for at least one session, just so we can do basic education about what chronic illness is and how it impacts families. Okay, so I'm going to wrap up by talking about when the emotions have become too significant, too big to handle on your own, and how you recognize that fact. So as I've said, emotional upheaval while you're learning to adjust to a chronic illness, perfectly, absolutely, 100% normal. Rates of depression, quite high. Rates of anxiety, quite high, but only for a brief period of time. It's a phase that people have to work through, and they normally come out the other side doing quite well. A lot of people, in fact, the vast majority of people, work through that process with very little assistance. So with advice from their physician or advice from family and friends. But there are some people who get stuck in that phase. In the normal phase, the emotions are transient, they come and go. Some days are better, some days are worse. And they focus really on the illness and on the losses associated with the illness. But if you become stuck in those emotions, which means they're not transient, you don't have good days and bad days, you only have bad days, that's a good indicator that you've gone beyond the point where you can do it all on your own. That's a good indicator that some help is probably going to be beneficial. If your emotions, your emotional reactions start to interfere with your daily functioning, so if you're too anxious to get up and face your day, you just want to pull the covers over your head, it's a good sign that you might need some assistance. If you're too sad and depressed, don't have the energy to get up and shower and start your day, or you can get up, but you don't really want to go out of the house, you don't want to face people, another good indicator that it's gone beyond the normal level. I want to emphasize that the earlier you get help with stuck emotions, the faster you start to feel better. So one of the unfortunate things is that people who come to see me often don't come until they've had their chronic illness for years and years, and they've been depressed for years and years. And if you've been depressed for 2 years before you even seek out help, it becomes very ingrained, and it becomes a very big part of your life. And so it's that much more of a struggle to work your way out of. It can be done, but it's harder work. So if you can catch it early, you're going to have an easier path out of the depression or the anxiety or the anger or whatever emotion it is you're experiencing. Even if it's gone on a while, we can help you work through it, and you can come out feeling very positive on the other side. It's just going to take longer. So reach out for assistance sooner rather than later. Now, I'm happy to answer questions, though in my experience, when there's a psychologist at the front of the room, people really don't want to ask questions. But I'm happy to answer any questions you might have about anything emotional, anything acceptance related, anything chronic illness related. Up on the screen, I have some resources that I highly recommend. Some of them are in the public library, so you can sign them out. Certainly, they're all available at chapters or can be ordered into chapters. The first one is what we kind of refer to in our field as the Bible. It's Kabat-Zinn's Full Catastrophe Living, which is a mindfulness book. He sort of is the person who started the whole movement towards mindfulness. The second book is a book that I ask every one of my patients to buy, and I work through with them. It's a book that basically helps you work through the process of acceptance. It's a really excellent book. You can do it on your own. It's a self-help manual, essentially. So you can work through it on your own, or you can have somebody help you work through it. And the last book is another book on mindfulness that is quite helpful. Absolutely. Stress is one of the key things that you need to target in any pain management program, because stress feeds back into the whole loop of pain. If you look at the cycle of pain, people will experience pain, and then you have emotional responses like stress, depression, anxiety, anger, fatigue. All of that just creates this feedback loop. So in order to break that feedback loop, you need to break into it at some point. Often, we can't break into it at the pain point. We've done what we can for the pain's here to stay, which means we need to break that feedback loop either by targeting the depression, targeting the stress, targeting the anxiety, whatever the case is. And the process of acceptance, the reason that, when I came out of graduate school as a psychologist, the focus was on breaking the cycle and treating depression or treating stress. That's what we did. And I sort of had this revolutionary moment, when I started reading all of McCracken's stuff, and I realized acceptance is the key. It targets all of that. Because acceptance is going to reduce your depression, improve your mood, reduce anxiety, it's going to reduce stress. That's the key to all of those pieces.
Then you won't get any kind of chronic pain. If you are just as calm and cool and laid back, you'll never develop the illness to begin with. Really, it's fact.
Stress does contribute to pain, absolutely. I'm not sure we can ever have a completely stress-free life, but
Not in today's world.
yeah.
When we were run down, when our immune system is way down, that's when it struck me. I was in trouble.
Yeah, stress really can have a big impact on your immune system, and then that opens the door for all sorts of illness. Absolutely. Yeah.
You use the word, the expression giving up. I don't like that. I would rather changing the intensity of your activities, changing, not giving up, looking for, I won't say cures, but things that will help your particular pain threshold, pain, whatever causes your pain to be worse some days than others. I've had fibromyalgia and arthritis for over 20 years, and I'm still searching, and I'm finding things for me that were not for you, not for that person. But I don't think we should ever stop or give up anything.
No, but see, you've tapped into exactly that distinction between what the research tells us and what the patients tell us, right? So when I say acceptance, I don't actually want you to give up things, but that is what patients hear, which is why we need to not necessarily use that word right off the bat, right?
Give up means you're never ever doing that again.
Yes, and it means giving up hope. And if you don't have hope, what do you have? So yes, you need to continue to have hope, but you need to not be so invested only in the hope and in that search that you don't continue to live life in the meantime. That's the distinction, right? But you're absolutely true. If I just say you need to accept, people hear you're telling me to give up. And that's not the message I want to give, which is exactly why I did the research. And it really was a big eye-opener. And I tell health professionals now all the time when I meet them, don't tell people to accept. Don't use that word, because until they really understand what we mean by it, they just shut the door and want to ignore you.
And some will give up too much, just lay back there, not even go for walks, and expect to feel well.
Yeah, and that accomplishes very little. Yeah.
I know when I was told to accept by my psychologist, by my physician, I laid in bed for a year.
Yeah. Yeah, and it can be very discouraging, right? And I think that's why it's really important to remember that there's two very big components to acceptance. Part of accepting is continuing to engage in important activities. It means prioritizing and figuring out which activities are most important and actually doing them. Yeah, I know, it's tough. It absolutely is. Yes?
I think that is really, really important in everyone having chronic pain.
Yeah, I didn't touch on exercise. I didn't touch on medication. I didn't touch on a lot of components of treating the pain itself, because my interest is the focus of the talk really was on the emotional components. But I agree, you need to exercise in order to manage a lot of painful conditions, especially arthritis. You need to get your joints limber, they need to be moving, or it's just going to get stiffer and worse. So, yes, there is. Yeah. Oh, well, that's because I don't exercise, and so it didn't even occur to me to put it on a list of priorities. No, exercise is very important, and actually, if you read the research on depression, exercise alone is an effective treatment for depression without medication, without psychotherapy, without anything else. It's the endorphins. The tough part is if you're depressed or you're in pain, finding the motivation to exercise can be very challenging. Yeah. Yeah. Okay, so yeah, the question about how much medication to give versus do we try other approaches instead of or before we give medication. Treatment of a pain condition or a chronic illness has to be a very individual approach. So for some people, they're really not going to be able to get by without medication. So, if you have rheumatoid arthritis, you should be taking the medication that your physician prescribes because it treats the illness, right? Yes, narcotic medication can be very effective. I'll take as much as you'll give me. Well, okay, here's what I tell my patients. I say, a physician can give you enough medication for you to not feel any pain. We can do that, not a problem. You're also not going to feel anything else, and you're not going to want to do anything else. And you're just going to kind of lay around. Is that the life you want? That's probably not the life you want. So pain medication is very individualized. What we want is for a person to be on the least amount that they can be on and still function as fully as they can. It's all about balance. So sometimes a person might be on this much medication, they come to see me, we do a bunch of work around pain management and self-management and dealing with the emotions, and as the stress comes down and everything gets managed, they can lower their pain medication. They may not be able to go off it, but maybe they can lower it. It's about finding the optimal balance. I am not pro-med, put everybody on meds, but I'm also not anti-medication because I think there's an important place for it. No. I can only talk to my patient about about the medication or what might be best. I often make recommendations to ask your physician about X or Y. Again, because I'm in the field and I know quite a bit about the different medications they might be taking. Sometimes I know of medications that their doctor maybe hasn't tried because they don't have the same level of expertise in pain itself. Yep.
I know for myself, a psychologist is really important in my life because it keeps me going and it keeps me staying positive.
Yep.
But what about people that don't have coverage?
Yeah, one of the really sad things about psychology is that it's tremendously effective. And we actually know that for every $1 you invest in psychology, you save $7 in the healthcare system. Yet psychology is not covered under the provincial healthcare plan. And getting in to see a psychologist in like the mental health centers where it is coverage, the wait lists are ridiculous. 2 years. So yes, it's really sad that people can't get in to see a psychologist if they don't have insurance coverage.
Yeah, I find that really sad because I know myself it helps me, but I have coverage. But when I hear people talking about not being able to do that, it breaks my heart.
Yeah, it breaks my heart too. So that's another avenue for advocacy. is that we need to have advocacy for access to mental health services, to actually have more psychologists in the publicly funded system so that wait lists aren't 2 years. And those 2-year wait lists, that's a 2-year wait list for you to have one appointment for them to decide that you're not immediately suicidal and therefore they don't need to see you.
No, that's not true. I'm seeing a psychologist now regularly.
That's good. It's rare.
Fortunate.
In Fredericton, it's pretty rare, right? But
That's a monkey.
yeah. But it's another avenue for advocacy for sure.
It's the same with massage. It's not covered. Like seniors' health plan, it's not covered.
Yeah,
And that works well.
yeah. Unless you have private insurance and Blue Cross, a lot of those aren't covered, unfortunately. Massage, physio even sometimes. The things that you can use to manage the condition overall.
Do you see that changing in the near future, that it would be included in this?
I don't see it changing in terms of coverage for psychology and coverage for other healthcare professionals because, you know, we're a poor province in terms, it's all about healthcare cuts, not adding to the healthcare.
And
So,
common sense is not very common in government, so it's not going to get better.
Yes.
oh,
When I was diagnosed, it was still called fibrositis. And before that, I was up in Hamilton, and I was diagnosed as RA, however, it never showed positive. I was diagnosed with lupus. It's funny, it showed positive for lupus.
yeah.
Just like me,
So
it's
after I moved to
fibrositis.
Moncton, well, I was diagnosed in Fredericton. I don't suppose they had doctor for arthritis.
At the time,
Dermatologist?
Didn't have very many
yeah.
They sent me to Fredericton, my doctor sent me to Fredericton, Dr. Gabalu.
Yeah. I mean, the interesting thing about fibromyalgia is that it's a diagnosis of exclusion, really, is that they rule out everything else because it's based just on symptoms. There's no blood test, there's no x-ray. So that's why it's often taken, I mean, some of the women in my study, they had symptoms for 20 years before they actually got a diagnosis.
Well, it's more than fibromyalgia, but Dr. Fredericton said, I don't know what you had 10 years ago. That was whatever it was.
Yeah.
Inflammatory rheumatism or whatever it was that I had.
Hmm.
And but he said, I know you don't have cancer, you have fibrositis. That's what it's called.
Yeah, as I said, our medical science is not always as advanced as we wish it was.
Well, this is quite a few years ago.
Yeah.
Nobody has mentioned Carfax magic bands. I have 13 or 14 of them. Different shapes, different sizes, for feet and hands and necks and back. And I always use that first before I would take anything, my mouth for pain. Because a lot of times it works before something I took my mouth would work.
Mm-hmm.
And it works, makes a big difference to me.
Yeah, there's a lot of individual strategies that work for different people. Absolutely.
But when people find something that helps them, it lowers the stress, it lowers all sorts of other things, the depression, anxiety, and everything.
Absolutely.
You just have to find a husband that accepts it and doesn't keep telling you to take a pill.
Now, husbands are a completely different matter.
That's right. That's a whole nother topic.
We're in a different place.
Yes.
Okay, I just wanted, this is gonna take about a minute, and then we're gonna finish up. So very, very first is to thank Dr. LaChapelle for coming all the way from
Thank you.
Fredericton to talk about this tonight.